I'm Dr. Gina Lokna, one of the sports medicine physicians here at ucdavis with the Department of PM&R, and I'm delighted to talk with you today about a topic that is near and dear to my heart. I feel very passionate about it, and this is a topic that I'm calling wellness as a lifestyle. So on our wellness journey today, I hope to inspire you toward an understanding of what the benefits of living a wellness of lifestyle can look like. And this is not a comprehensive view of all things wellness. This is through a specific lens where I want to give a little bit of a framework or a scaffolding around some of the elements of a wellness lifestyle that are hopefully accessible to you. So maybe think about this more as a map through a journey of wellness. This is a take on things that are built into the whole person lifestyle of trying to aspire toward wellness, not just for disease reversal or management of chronic disease, but hopefully more toward an inspiration of a life of wellness prior to even being sick. So what we'd love to do is capture wellness and practices of wellness as a preventive strategy so that we can do more well care with our patients rather than doing disease management with our patients. So the lens that we're going to use today for our scaffolding or for our roadmap comes from a specialty called lifestyle medicine. And lifestyle medicine has used 6 pillars of health to explain a journey toward wellness, and largely used in different practices with dietitians, with physicians, with nurses, with lots of support staff to try to teach and educate people about the most important elements to include when we're thinking about wellness. We're going to learn about actionable evidence-based practices to support health and well-being. And finally, I'm going to take you through something called SMART goal setting. That's an acronym. And SMART goals are an easy and focused way to take manageable bite-sized chunks when we want to make some changes and we want to monitor how successful we are in the outcomes of those changes. SMART goals has been a very, very helpful practice to use with patients. I've used it myself, as you'll hear in one of my slides, and we'll give some examples of SMART goal setting as we journey through our health pillars. So what is lifestyle medicine? Lifestyle medicine is an evidence-based approach to preventing, treating, and even reversing disease or replacing behaviors with positive ones, again, more along the lines of prevention before we get to disease states. These pillars include things like eating healthfully, being physically active, managing stress, avoiding risky substances or abuse, adequate sleep, and having a strong support system. So through this talk, I'm going to reference back to this little illustration, and we're going to hit the pillars as we go through. I'm going to start with the one that's near and dear to my heart, no surprise, as a sports medicine specialist, and one that I think foundationally is very hard to replace for its myriad of physical activity benefits. And it is a systemic approach to lifestyle and wellness because at the cellular level, we change, we adapt when we move, when we get strong, and when we're stable. So on to the SMART goal acronym. At the end of this section of exercise, I'm going to illustrate to you what one of my SMART goals was for 2024. The SMART goal acronym stands for the following. S is for specific, M is for measurable, A is for attainable, and R is for relevant. T is for time-based or timely. So our first pillar of wellness from the lifestyle medicine graph is called exercise or physical movement. And exercise has a range of recommendations that we'll talk about. And it really can be summed up in those 3 words in the graphic: move, get strong, and improve stability and flexibility. Wherever you're starting from, even if you've come through a period where things have been fairly sedentary, the process of beginning to move will meet up with the cells in your body that are all wanting to adapt to something more positive. Our bodies are miraculous at being able to adapt to change. And so we can harness that when we implement some of these recommendations. So I have a lot of enthusiasm when I talk to patients about these 3 elements. So if we want to think about 3 different legs to a stool, balanced exercise programs include the following 3 elements. Movement or cardiovascular exercise, our goal is a minimum of 150 minutes weekly. I put a range there, 150 to 250 minutes weekly, depending on levels of fitness and desired outcomes. Number 2, get strong. This is an area where there's a lot of variability. Some people are doing mostly strength training, very little cardio. Other people, the reverse is true. They walk every day and they've got that movement element going, but we are not very strong. We're not working on building muscle strength and muscle mass. The third pillar of the program is improvement of stability and flexibility. This is a really, really key component that sometimes doesn't get as much attention because perhaps we're motivated to do the exercise for certain reasons, maybe certain aesthetics, maybe we have certain goals around weight loss or optimization of a certain physique. And improvement of stability and flexibility can kind of be the forgotten element toward achieving those kind of goals. But 2 days a week at least of some dedicated flexibility and stability training, this would also include the core, is really important to build into a long-term exercise program. So this will be our overarching goal set as we go through the various slides, and we'll take each element as its own separate entity. All right, cardio or aerobic exercise. This is maybe what most people think of when they're referring to an exercise program. This is the 150 to 250 minutes a week recommendation. And a couple of things that come up for this very, very commonly. We might call them frequently asked questions from patients to me as a sports medicine specialist. And they might say things like, one more thing to do in my busy lifestyle. I try. How can I do this without being overwhelmed by that large number of 150 minutes weekly? And I say this to you, start where you are. Busy people can move. You can take extra steps in the parking lot. You can do a loop around the block at lunch. You can do things like having an under-desk treadmill for steps. I have a colleague that does this with excellent effect, and we all admire her greatly for it. There are lots of ways to get moving, and one of the high-yield areas of movement in short doses is after meals. Turns out that as we load with a nice, nutritious meal, all of those good chemicals that we're ingesting for the purpose of cellular energy are really mobilized more efficiently if we move afterwards. The other thing to tell you about busy lifestyle is that exercise is cumulative. So whether you're doing 5 or 10 minute bouts at a time or 20 minutes at lunch or another 30 minutes at the evening, that all counts. It doesn't have to be consecutive. Let's talk just a little bit about the way we perceive this exercise intensity. This has become a really, really popular topic of conversation because the acronym HIIT training is one that a lot of people are familiar with. That's the high intensity training that is all out for short bursts of speed, and there is without question a lot of benefit to HIIT training, but I'd like to place it in its proper perspective. If we're going to aim for 150 to 250 minutes a week of cardio exercise, the vast majority of that needs to be down in the 60 to 7% max heart rate range. And instead of using that as a math calculation, I'd like to suggest another method to you. RPE stands for rate of perceived exertion. This turns out to be a really accurate measure of how hard we're working. So if you're exercising and you're still able to sing a song, or you're able to carry on a whole conversation with your walking partner beside you, you're not in zone 2 or 60 to 70% of max heart rate. It's too easy. So you should be slightly breathless. It should feel effortful, but you should be able to communicate. So this isn't your all-out effort where you feel sick to your stomach and you're pushing at full force. That is the high-intensity interval training. So out of a whole week of, say, 150 minutes of exercise, the HIIT training is really in small doses, maybe 2 to 4 minute intervals, and you might do 3 or 4 sets of repeats. So it's a very small slice of the overall cardiovascular pie. And here's why that matters. If a person is coming into my office and saying, Dr. Lokna, I'm seeing you for my knee pain. I'm already trying to get my walking in and my knees are killing me. Never mind trying to get out for an hour a day or trying to do a faster speed to try to elevate my heart rate to these higher levels. What I tell them is this: we don't want to overshoot the mark. It's better that you have a nice foundational, sustainable zone 2 cardio program, and it's likely going to be something that involves cross-training. So weight-bearing exercise like running or walking can be a bit hard for a person to sustain over a week if you have arthritic changes or degenerative changes in the knees or in the hips. Those are our large weight-bearing joints. So instead of focusing on one form of exercise that we want to do over and over and over again, consider spreading that out with some types of cardio that are less impactful. So running, cycling, stationary cycling, Peloton, they actually build in lots of HIIT training intervals. Swimming, I already mentioned the under-desk treadmill. As creative as you like to be in terms of getting your heart rate up, that's what I recommend to achieve your total weekly minutes. That is a nice way to redistribute the load through your body's musculoskeletal system and usually is much better tolerated. All right, let's move on to strength training. Strength training is a big topic of conversation in my practice because a lot of people are under strength training. And there's a particular group that I'd like to impress on the importance of this strength training, and that is women in middle age dealing with some additional hormonal changes in peri or postmenopause. And here's the reason. Strength training is the biggest contributor from a lifestyle behavioral standpoint to increasing bone density and health. So when we measure bone density or body composition and we see women or any patient who is low in their skeletal muscle mass or what we call lean muscle mass, this is really at high risk for things like osteopenia or osteoporosis. That contributes to increased joint pain and dysfunction, and finally to decreased stability and increased risk for falls. So that's a slope that we don't want to start sliding down, and strength training is our most powerful tool to bring into play. Aim for 3 times a week. So again, if you're just starting, don't let perfect be the enemy of good. Start 1 or 2 days a week. Remember, these goals are overarching for a period of time that is going to be what you do over the next months to years. This is not what you need to be doing in 2 weeks. So aiming for 3 times weekly, but starting where you are, begin to include strength training. And here's the definition. It's easy. You're pushing and pulling against progressively heavier things. The technical term for that is progressive overload. And the reason is that our cells adapt to this certain controlled stressful stimuli, and they're able to affect change over time. So it takes them a while, but you'll notice, for example, when you first start a workout program and maybe you pick up a hand weight and it's 5 pounds and you're doing some exercises with your upper body and you feel, I'm sore. I'm sore the next day, or you feel it while you're doing the exercise. But if you keep at it for 2 weeks, guess what? It doesn't feel like anything anymore. The soreness response disappears. That's adaptation. And so the reason strength training is a very helpful thing to add into your weekly routine is that it is something that has a moving target. And there are, again, a lot of ways that you can accomplish this. I'll share with you my recent favorite too. Not everybody has the access to go to a gym, the interest to go to the gym, the funds to go to the gym. No problem. There are a lot of other ways to bring about the resistance training that I'm talking about. Some people have a setup in their home, and that those can be kind of quite sophisticated depending. But they can be as simple as free weights. It can be as simple as ankle weights. Pilates resistance balls. My favorite recently are the resistance bands. I love the circle bands that I'm currently using for my legs. These are adaptable. They start low. You can use more of them in terms of repetitions. They change with their elasticity, so they have a built-in adaptive response. And they're really inexpensive. You can get a set online and just put them in your door frame and do them. They're in line of sight, so it's hard to forget. Body weight resistance exercises also count. So my experience with these is that they're a difficult place to start. So if we're really not at the point where our strength can support body weight, starting with a program of pull-ups or push-ups can be overshooting the mark just a little bit. So we want to build a nice foundation and then grow as we're able. Notice that a lot of these that I mentioned are portable. So that's a really helpful thing if you're a person who's busy and traveling or have something set up in your office. Again, anything to try to get those multi-times weekly is very, very helpful. I get a lot of questions about the specificity of weight training programs. And this is hard for me to answer because it really depends on where you are. And trainers at many gyms can be an excellent resource. I'm actually not really picky about where you start in terms of the strength training. It's more important for me just to have you begin. It can be as simple as the rule of 3s. 3 large upper body muscle groups, 3 large lower body muscle groups, 3 times a week for 3 sets. So if you remember the rule of 3s and you're just beginning, you don't need to be intimidated by doing it wrong or doing it more correctly. Just start in. You'll start to see the benefit, and it's really, really enforcing. The other thing that I just want to mention before we move on is, in addition to the benefits for bone density and the musculoskeletal system, this is a huge supporter of metabolism, especially with blood sugar regulation. So as there are a lot of people who are in the pre-diabetic range or have adult onset type 2 diabetes, really struggling with blood sugar control, I want to put in a big plug for the benefit of building more muscle mass. Muscles have a tremendous draw for needing to take in blood sugar for fuel, and it has a way to do that very, very efficiently. The more muscle mass you have, the more it's contributing positively to your improvement in metabolism, insulin resistance, and reducing blood sugar levels. Okay, on to flexibility and stability. The one leg of the stool that I was talking about that most commonly people have a little sheepish expression on their face when I ask them, what do you do every week for flexibility or stability? Oh, that isn't something I'm very regular at. Probably if it's not in your routine or it feels very uncomfortable for you, you're the very person that I'm talking to who might benefit greatly from it. Again, wide range of flexibility for the method that you use. This can be as simple as something a couple of days a week where you do a dedicated mat stretching class. There are a lot of programs online that are very helpful for this. Some of them are membership based. A lot of those came out of the gym closures around the pandemic and COVID. So these can be excellent resources, very, very affordable. Many are free. And again, the point is to just get started. It can go anywhere from something as informal as that sort of mat stretching protocol, all the way up to classes that you might engage with. Tai Chi has a lot of excellent data for patients who have joint osteoarthritis for improvement in mobility and flow. This amount of flexibility helps to lubricate joints, it helps to preserve muscle flexibility, and it gives additional joint support, again, for the purpose of stabilizing and improving functional outcomes, reducing falls, helping you be able to get up from the floor when you're seated, helping us to arise from chairs, climbing and descending stairs. This isn't all about preserving function for exercise. Some of this is really just for daily life. Over the long course of time, as our bodies change, we need to build in a flexibility program. The other element to flexibility and stability is our core. I talk to patients frequently about what I call our base of operations. This is your middle. This is not just the ab muscles. This comes around into the hips, the glutes, and the low back. And core exercises are often a very nice addition to joint flexibility programs. Classes like Pilates, with or without the reformer, classes like yoga, depending on which type, they can be very, very valuable in terms of a routine of building in core strength in addition to flexibility. So the benefits, again, are myriad. They improve joint mobility, reduce fall risk, help with the daily activities of living, and improve balance. Tai Chi, Qigong, yoga, and Pilates. Those are sort of the common ones that I'll mention. Another benefit to these, if you'll notice, is that they can be group classes. Tai Chi and some of these are often held outside. As we'll see later, being out in nature can be an excellent way to connect with people with common interests. So you begin to stack the benefits of wellness when we start looking at creative ways to get these exercise requirements in place. Okay, I promised you an example of Gina's SMART goals for 2024. I was doing a fairly good job of cobbling together a 2-time-a-week resistance training program, but I felt that my body needed a little bit more challenge, and so I created a SMART goal for myself in the new year to increase my strength training regimen from 2 to 3 days per week. So I was very specific. This is, notice, a bite-sized goal that I'm taking on. It's measurable. I can track it every calendar week. I can also track my strength increases for that progressive adaptive overload. It is, yes, attainable to me. It's realistic with my current schedule. It's very relevant because I want to take advantage myself of all of those optimal strength training benefits that we were just talking about. And it's timely. So it's tracked on my calendar with my weekly exercise routines. And I'll tell you what, this is a great way to hold yourself accountable. I'm kind and gentle to myself about it. I'll be honest with you, I don't hit it every week, but this is what I aspire toward, and this is what I am holding up as an ideal. So just in setting that, it gave me a little bit more of a push or a nudge toward the direction of building in time for it. So here's an example of a SMART goal. You might have a SMART goal of moving for 5 or 10 minutes after a meal. You might have a SMART goal of increasing by 10 to 20 minutes per week your overall cardio exercise. And this is the format that has been shown to be very effective in terms of creating long-term change. All right, on to our second pillar. So if I said that exercise is very, very foundational for its myriad of benefits, it's really hard to replicate those with anything else that we do with our bodies. This would be pillar number 2, the nutrition pillar. And from a lifestyle medicine perspective, I'm going to sum up my next few slides in these 3 lines. Whole food based, plant predominant, and minimizing of processed foods. So we aren't going to get too specific about the kind of diets out there, of which there are a myriad. And there are many, many people. There are accomplished chefs, dietitians, nutritionists, who all have lots of fantastic information and resources on how to implement this. But I'm just going to give us a top contour of what I'm focused on, where the data is very, very compelling to show extraordinary changes in chronic disease reversal and in disease prevention using these 3 predominant foundational principles. All right, here's one. I put it in quotes because I say this very frequently to patients, and it sums up a lot. Eat the rainbow. Look at this picture. This is in a farmer's market. Notice how colorful food in its natural live form is. Farmers markets are excellent places to see what is being grown locally, what's being sourced with minimum processing, and what's seasonal. I'm a huge fan of farmers markets. I like to go routinely. It's fun to take the kids. They get an education on what seasonal, organic, minimally processed foods look like. They're not perfect, shiny, and waxy. They degrade. They don't look perfect. They have little bug bites and leaves that are kind of chomped, but they are power-packed with phytonutrients that you are ingesting. So all of the phytochemicals, the antioxidants, the vitamin and minerals that are contributing to this vibrant picture of fruits and vegetables that are seasonal are what you're ingesting. Guess what? Your cells are crazy for this. We are a series of biochemical reactions in all of our trillions of cells, and they're starving for great ingredients. This is the foundation of where that kind of thing breaks down. So, nutrient-rich foods are really where it starts. This is what you want to plan your dietary intake around. It has benefits, I mentioned, on the cellular level, and what that translates to is better energy production. We have these little mitochondria in each of our cells. They're like our power generators. They run and fuel on food that is nutrient-dense and power-packed. This is really the area where there's a tremendous amount of research on reversing and preventing chronic diseases. So it's very literally something that we consider food as medicine. All right, in a nutshell, here are a few categories that I'm going to mention. High fiber foods are pretty easy to attain if you're eating a whole food, plant predominant diet. The reason is that they're minimally processed. So I just put one example in there of green leafy vegetables, very high fiber content, but also, again, lots of phytochemicals with their green leafy color. Healthy fats are actually an important component of all diet. Our nerves incorporate, and our cell borders incorporate healthy fats, and it's a necessary part of our cellular robustness. Our brain is covered with a lot of fatty tissue in terms of cellular support. It needs healthy fat sources to help support all of those things. Omega-3 fatty acids is a common one that many people have heard of. A monounsaturated fat, olive oil, another common one. Avocado oil with a higher burn point, a little safer to cook with at higher temperatures. I'm going to mention clean source protein. protein is one of those words that lands with a lot of weight. I get a fair number of questions about protein, and I'll address a little bit of that later in kind of general terms. But I do want to tell you that there is an enormous reservoir of protein available from a plant-predominant or plant-based diet. And I mentioned a couple of categories there, beans and legumes. Soy would be another one. If we're sourcing for animal source proteins, we're looking for things that are, again, minimally processed, grass-fed, wild-caught, if we're looking at seafood sources or fish. And then finally, complex carbohydrates. This would be in contrast to simple starchy carbohydrates. Complex carbohydrates tend to be more whole grain. They have a different effect on blood sugar spikes. They tend to have more fiber, refer to line number 1. And that has a whole host of benefits, not only at the cellular level, but also in our gut microbiome. So what we want to do is eat plenty of the things on the left. See if you can build in some of those into your weekly diet. Lots of vegetables, additions like mushrooms, fruits, seasonally eating, legumes for protein source, whole grains for complex carbohydrates. Nuts have a great source of protein and omega-3 fatty acids, as do many seeds. And if we're trying to reduce things like additives to our diet and go lower sodium, the addition of spices and herbs can be fantastic. There's great data on the benefits of a spice called turmeric. And in its more concentrated form, it was studied as an anti-inflammatory with good response for patients that had a lot of joint inflammation from osteoarthritis. And finally, I'm a big proponent of increasing our hydration, and water is irreplaceable. All right. So here is the punchline for processed foods. We want to largely avoid the processed on the left. Notice that there's plenty of color here. Notice that in contrast to our farmer's market slide, this is all chemically driven color. You're not ingesting any beneficial ingredients generally from this. And so one of the areas to really support eating less is in the foods that have a lot of sweetener and additives. Obviously, this is true about sugary drinks, including juice. Energy drinks are another source of a lot of additives. Processed meats, so undoubtedly there is protein somewhere in the mix, but at the cost of very, very high levels of saturated fats and additives, tend to have a pro-inflammatory effect in our system. Processed snacks that are largely the result of some simple carbohydrates, in addition to the sweetened foods like desserts. And then finally, the sources of fat and meats and dairy and poultry that would be an outsized percentage of our daily diet. So this is something, notice it says eat less. It doesn't say don't eat any, but we're wanting to bring this into a more balanced program so that the vast majority of what you're taking in is really of high benefit at a cellular level for energy production. Okay, what would be an example here in a plant-predominant or plant-based diet? So these are some frequently asked questions for patients, and I'm kind of a visual learner, and so I like to create word pictures for my patients. And I say this simple exercise. Picture your dinner plate, and when you look down, have half of that plate be veggies. So this would be a very colorful half of your plate. It might be lots of greens, it might be lots of seasonal color, depending what time of the year, but half of the plate as veggies. And I don't think that's what most of us grew up learning about. We just had a little token sample here in the corner of our plate, but we really want to expand that. Quarter of the plate of clean source protein, and again, you can select which version of protein that you're interested in consuming. The general recommendation, the absolute minimum of 0.8 grams per kilogram per day of protein is, I think, fairly widely considered as inadequate, particularly as this nutrition pillar is coming on the heels of what we just discussed for the exercise and the strength training. Guess what? Your muscles need protein. The amino acids are the building blocks. So if you're actively working to increase your strength training, it needs substrate. It needs building blocks. So I put a range of daily protein, not because this is the indisputed number that's magical, but more so that you get some sort of a calculation idea of how much we should be fueling with if you're having an active lifestyle and focusing on good strength training. So half of the plate is fresh veggies or minimally processed veggies, a quarter of the plate of clean source protein, and that could be plant source protein, and then 1/4 of your plate as complex carbohydrates. So this would be low on the starchy side. We want them to be more fiber filled. That would be an example of a plate that I draw for patients as a goal. Again, maybe a SMART goal for you to consider, that one day a week you're going to be deliberate about looking at the percentages on your plate and see if you can shift it just a little to more of that live food. And finally, to supplement or not supplement, this is largely the question I get around protein. I'm not going to spend a lot of time on this, except to say that in some very restricted diets or in patients who have come through and done a body composition test and they're really, really, really underpowered from their skeletal muscle mass, and we're trying to boost that partly with the strength training, it may be appropriate that we're supplementing some protein to the dietary intake, never in place of, but a little bit of supplementing to get us up to more of that goal as we're working on building increased lean muscle mass. That's very individual specific. All right, the last mention in the nutrition section is more around gut health. Again, we've probably all heard about the gut microbiome at this point. These are the billions of so-called healthy or friendly bacteria that coexist with us. They do things for us and we do things for them. It's a very nice symbiotic relationship, and it is becoming increasingly clear that it plays an important role in not only just absorbing the nutrients that we eat for our gut function, but also in mediating things like our immune responses and our inflammatory responses. There is now a well-established set of evidence around a gut-brain health connection and mediation of hormones and regulation of some of the stress hormones as well. So the picture to the right is an example of some of the fermented foods that have been talked about to help support healthy gut microbiome. Fiber-rich foods, so that half of the plate of veggies that I just mentioned, would be very, very gut health supportive as well. These fermented foods, I just want to make a note, they are live culture kind of fermented fruits. So these are not the things that you would be finding on a shelf or in a can. Those are largely vinegar-based. They're not live cultures. These would be the things that you would be finding in the refrigerated section of your grocery store. So the pickled things, pickled veggies, miso, some of those types of things. And again, this is a fun area of experimentation if you haven't ever taken a trip through that section of your refrigerator part of the grocery store, experimenting a bit with small doses of fermented foods just to see how you like them. They're very flavorful. All right, third pillar, sleep pillar. So I don't ever get arguments from patients about the importance of sleep. I think that we all know that this is vital for our health. It seems to be a little bit more elusive than we'd like it to be sometimes, and there are a lot of reasons for that. Nevertheless, sleep is one of the most significant contributors to mental health. So one of the things that our brain does in the sleep state, as we're cycling through the various stages of sleep that you've probably heard about, the earlier lighter sleep cycles, the REM sleep cycles, and then the deeper sleep cycles. This body of yours, and particularly of the brain, they're not quiet during this period of time. It might shock you to know that your brain is actually doing a tremendous amount of housekeeping, clearing out debris, laying down connections. This is now known to be a part of important memory integration. This lands very hard for college and graduate students who are working to study, pull all-nighters, and then hope to remember. Turns out it might be worthwhile to go ahead and invest in the sleep. It seems to consolidate the memories a lot more effectively. So there are a couple of ways that we can assess our sleep needs. One is qualitative. Qualitative is always in a number form. And the other would be quantitative. How do we describe it? So qualitative sleep requirements for adults, fairly widely accepted to be 7 to 9 hours. There are very few outliers that truly are benefiting from 5 hours of sleep, 6 hours of sleep. Occasionally you hear people who say, oh, I have a low sleep requirement. Might be more of a sleep deficit that you're just not feeling, and certainly not getting as much of that time to do those important neurologic housekeeping functions as you would if you were expanding more toward the 7 to 9 hours. And of course, depending on age and special populations, adolescents whose body and minds, their whole job is building new connections and growing, the sleep requirement for them is much higher, 8 to 10 hours per night. So qualitative sleep, and this is something that in a word we might call restorative. Restorative sleep is usually a word that a person will recognize, and there's not one precise definition, but when you wake up, do you feel well rested? Do you feel energized? Do you feel like you had a good night's sleep? This is a subjective experience of sleep, but it's an important one to measure quality. Of course, sleep is influenced by all kinds of things, by hormone cycles, by stress, interestingly, by temperature. And this is borne out. A lot of people have their own subjective stories around this, but it really is true that in environments that are a little too heat sensitive or a little too high in temperature, it is more difficult to get a restorative sleep experience. So what do we do when we talk about sleep? Well, Dr. Matthew Walker is a sleep scientist at UC Berkeley, and he's widely regarded at this point as being a renowned resource for giving lots of good information around sleep, sleep cycles, sleep hygiene, kind of some do's and some don'ts. But it doesn't need to be overly complicated. So the idea behind sleep is that we're wanting to engage with some of our rhythms on a cellular and, again, systemic level. We have rhythms that are built in to our body function. It's called a circadian rhythm. You might have heard of this before. And there are different environmental markers that to trigger circadian rhythm regularity. One important one is light. And light exposure during the times of awakeness are a signal to the brain so that it can support alertness, and it's go time for the body when it's light. So morning sunlight, getting an exposure to light in any way you can, even bright indoor light if sunlight is not available to you, helps to start the clock running that, okay, we're beginning our awake cycle at this point. As we go through our day, there are different hormone levels that rise and fall. But suffice it to say, as we come toward evening and we're getting toward sundown or dusk, it's signaling to our body, okay, we're coming down toward the sleep wind down period of our day. So in our homes where we have electricity readily available to us and all of our devices, it takes some doing to replicate that circadian light cycle in our routine. But this is an important part of sleep hygiene. In the evening, dialing down bright overhead lights, maybe turning on more low light floor lighting, putting on dimmers, changing our blue screen exposure. These are all important cues to your circadian rhythm and cues to your brain and body. We're getting ready to wind down. This is all part of what we're calling sleep hygiene. Another important element would be to create a bit of a ritual around what the bedroom kind of sleep, get ready to fall asleep routine should be. Again, from Matthew Walker, he gave a really fascinating analogy that I liked and always remembered. Falling asleep isn't like turning off an electricity switch or a light switch on the wall. Falling asleep is more like landing a 747. This is complicated. There are a lot of systems that need to make micro adjustments. So light is one way to help that. Using the bedroom for sleeping is also very, very helpful. So there are nighttime rituals that people sometimes do with breath work. Some people are doing restorative or restful yoga routines with gentle stretching, relaxation, meditation, essential oils. All of these things are signals to your brain and body. We're getting ready to wind down. This is very, very helpful in prepping in our busy lives as a transition from our active to our falling asleep into that restorative pattern. All right, what are the things to kind of avoid? Obviously, caffeine too close to bedtime is going to artificially keep our system revved. It will be hard to override that with these kind of rituals. Everybody's body is slightly different, but it's generally agreed upon at least 3 to 6 hours before you want to go to sleep that you avoid caffeine. I have to do that a lot sooner. So if we're going to bed at 10 p.m., I'm generally not having caffeine past lunch. But some people can edge that a little bit later. We're avoiding things that are so-called sleep aids. So when we're desperate for sleep, I've had many a patient tell me over the years, I'm just desperate to go to sleep. So sometimes I need a little help. Sleep aids can come in a lot of different forms. over-the-counter forms, Benadryl, Unisom, sometimes the prescription strength forms. Some people are using sedating substances like alcohol, and they tell me, but doc, I'm sleepy. I got the best sleep of my life. Here's what we know. It is sedating, but it is not restoring in your sleep. It is not restorative of these sleep cycles. It's actually disruptive of sleep cycles. So temporarily, you might have an easier time falling asleep because of that sedating effect. But unfortunately, we're not entering those repeat approximately 90-minute cycles throughout the night where you're going through all of that important housekeeping activity and you wake up in the morning and often the sleep is not restorative. So avoiding or minimizing those wherever possible is really important. All right, the stress management pillar. This is tough. So our bodies are designed to handle and to be perfectly equipped for short bursts of acute stress. It's a survival mechanism. It's an important part of our fight or flight system. If we're escaping imminent harm and danger, we need all systems go. This is an adaptive response that is a really, really critical one, and that's been preserved in our bodies through a series of complex chemical reactions triggered by the brain. Most of that is involuntary and is happening really, really rapidly. What's the problem? The problem is that we live in a time where often that acute adaptive response, where we would have the fight or flight, we would run away from the imminent danger, and then once the danger is passed, we're getting a little decrease in those stress chemicals and we're resetting back to baseline. Our body is designed to do that with our sympathetic autonomic system and then restore to baseline with our parasympathetic system. This is largely hormonally driven and it's very, very connected to brain function. Here's the problem. When we run at a level of chronic stress that's too high, we have lost the adaptive response of a rise and fall, and we're just staying at a heightened autonomic system state. Our sympathetic overdrive is too elevated. This is getting a lot of attention lately because there is connection with chronic disease, chronic inflammatory states, and hormone dysregulation. And it's a really tough thing to voluntarily change. There's a lot that plays into our chronic stress response, and not all of it is what we're going through presently. We bring with us all of the challenges in life that we've experienced. So trauma plays a role in some of this, ongoing disconnection, isolation, loneliness. This was a big deal coming out of the pandemic and COVID, where a lot of isolation led to chronic loneliness. This is the Surgeon General's message that this is an epidemic of our time, and it's adding to our chronic stress burden. So a variety of things have been looked at to try to, at a physiologic hormone level, change what our set point is. What is our baseline that we're carrying in terms of stress? And I'm going to introduce you to a term here called stress resilience. Resilience is a term we've probably heard about in a lot of different contexts, but resilience is the ability to move through a series of circumstances and adapt positively. So we come back to a place of positive adaptation, and generally speaking, it's thought to be an accommodation toward an improved state. Another term that I'm going to introduce is something called stress hormesis. Stress hormesis is small doses of controlled stress, largely mediated through what we're doing in our physical body. So these would be things that we put ourselves through on purpose to be stressed. But again, what we're aiming for is more of that acute stress response with a decline to baseline rather than holding our set point higher. So some of the functions that we've seen that achieve this stress hormesis or training in stress resilience are seen in this sort of a terrifying picture that I have there on the left side of the slide. So ice baths, and of course not everybody is jumping into nature's ice bath as we see there, but cold plunges. Everybody's heard now of cold plunges. Lots of gyms have cold plunges. People have their own cold plunges at home. The idea is that when you sit in a cold plunge, when you expose your body intentionally to brief periods of very cold temperature, it doesn't like it. it induces a stress response. So this same hormone cascade where our sympathetic tone increases, where our cortisol increases, has a peak. But guess what? When we leave in the subsequent hours, now we get a lowering back to a better baseline on the other side of things. This is stress hormesis, or training for stress resilience. Cold exposure, deliberate cold exposure, isn't the only method to do this. There's been a lot of attention given to the sauna and then the cold exposure and the going back and forth. But these protocols, in addition to exercise, which has its own stress mediating response, can be very, very helpful in shifting our physiologic hormone set points so that it's better accommodating our cortisol cycles. Breathwork is another way that we help to manage some of that nerve-mediated sympathetic, parasympathetic tone. We're trying to shift some of those set points for our body so that it comes to rest at a more healthy baseline or level. So stress management looks different for everybody. I'm not going to pretend to understand what is going to be the best fit for each one of you. I'm just merely selecting a list of things that have been shown in the data and in practice to have a meaningful reduction in these stress hormones, cortisol and our sympathetic tone. They are also largely engaged in addressing some of the other causes for chronic stress that can be overarching. So the things that I mentioned before, the isolation, the loneliness, these practices are often done in collaboration with other people. Mindfulness or meditation practices have been around for a very, very long time in terms of changing the way our brain plasticity and function is accommodating to our environment. Being out in nature has long been regarded as a huge factor in stress resiliency, out in the colors, out in the fresh air. And there's something that is very, very relaxing and set point changing about being out in nature in whatever form. Many people are using spiritual practices in this way, gratitude journals, and then taking time for creative activities or hobbies. These are your joy measures. These are the kind of things that might give you a little surge of positive adrenaline. You have enthusiasm, you're looking forward to it. And again, a lot of these can be done not in isolation. They can be done outside in a park. I mentioned the Tai Chi class in the exercise pillar. These can be done in collaboration and in community, in some cases forming new connections. And so you can be as creative as you like, but the idea is you're building in practices to affect physiologic change for the better. Our social pillar, a social connection pillar, so this follows on the heels of what I was just mentioning. Research is showing that the single most important predictor of human happiness and long life is having strong social connections. We are, again, in an era where this is really, really timely. It's hard to socially connect when we've been so isolated. Lots of at-home work, lots of Zoom meetings, lots of gym closures, lots of things where we haven't been able to do as much face-to-face, eye-to-eye time spent together. And I think that our body holds that. We really do feel it. So nurturing relationships, sharing new experiences, again, like we mentioned before, along the lines of stress reduction, finding groups that have similar interests or are willing to explore some of these things. Maybe you have some SMART goal that you have set. Maybe you decide that a farmer's market might be a nice place for you to go on a Saturday morning. You'll meet the kind of like-minded people there that you might end up having a little bit of social connection with. But spending time with others turns out to be a really important factor in a lifestyle of wellness. And finally, I'll mention avoiding risky behaviors. Avoiding risky behaviors are typically thought of as centered around substances. This is obviously around the health or lack of health risks related to tobacco and excessive alcohol intake or other substances. And I just want to say in this section, giving yourself a lot of patience and support and compassion around some of these behaviors. It's rarely that it's in isolation. Often these are used, like I mentioned in some other slides, we're having difficulty sleeping, we're having difficulty managing chronic stress, loneliness, isolation. These are larger issues that are parts of our life that are hard to boil down to just one behavior that we're doing. But I would just encourage you to consider this as a really, really helpful, potentially smart goal setting area where even if you're making small positive changes, it takes time. It takes time to alter these behaviors. There are a variety of different approaches, and please know that there are resources available. Many attempts are often the norm when it comes to this, and so there's a lot of guilt and shame that can come into play here. And I would just encourage you to give yourself patience and support and reach out for help, for tools to try to get past this. On the road to wellness, these are the kind of things that can really sabotage our best efforts. So in conclusion, wellness as a lifestyle is one of my very favorite topics. You might be able to tell that I'm very passionate about it. Whenever I can, in my role as a sports medicine physician, I'm really talking to patients about this. I view it as a much more systemic way to promote good health. Yes, I'm a fan of exercise, and yes, I take care of a lot of knees and joint complaints. And those are the kind of things that impact our ability to do these practices. But this is one example of a roadmap or a journey through some pillars that might help give you a scaffolding or a lens in on some of the behaviors that have an outsized positive effect on life. And I encourage you to give it a try. Thank you for your attention.